came back from a run and I didn't smell, you know, like, I said, how can this be? Hi everyone, my name is Dr. David Kulla with Synergy Wellness in New York City. Today I'm doing this video because this is an important issue that many people with COVID have suffered from, the inability to smell. For any of you that have had COVID and lost your ability to smell, it's a little bit concerning, but it comes back and it tends not to be a major issue for most. But we have some cases where a year later or more, they still can't smell. And we have a husband and wife here that both had COVID last year at the height of COVID in 2020, in March or April? 2021, sorry. It's already 22. Yeah, losing track of time. It's just flying by. So last year around March or April, you both had COVID, and now we're talking about almost a year later, right? And why don't you tell them about your symptoms, and then we'll...
Okay. Well, the first thing that happened was shortly after getting COVID in the end of February, beginning of March, that's when I just lost the sense of smell. I didn't even realize it until my wife had pointed it out to me. She asked me to close my eyes and brought over a jar of peanut butter, and I smelled nothing. And it blew me away because it's not a sense that you really put a lot of emphasis on. You know, sight, hearing, yes, but smell you don't really notice right off the bat. And then it started getting better. So by the time we got to, say, June, we were going to restaurants and enjoying the food and so on. But then a couple of months after that, by September, October, started losing it again. And all through that time, there's been this almost constant metallic dust talcum powder smell in my nose. And we joined a couple of different support groups, and I saw a video of Chiropractic down in Houston, and they talked about doing an atlas adjustment and ARTHROSTIM and people recovering. So we tried with Dr. Dave here a couple of weeks ago, actually New Year's Eve, and while I didn't get my sense of smell back, the sense of what we now call a COVID smell was dramatically different. In fact, dramatically reduced, I would say at least 80%, to the point where most of the time now I don't smell, but I don't smell the COVID smell. I don't have that metallic
talcum powder
smell in my nose.
Okay.
I'm still, my brain is still not having the ability to process actual smells though, because like, for example, coffee doesn't smell correct to me. I can't smell lemons at all, for example.
Taste as well.
But taste. I mean, I can get taste is a little bit off as well.
Okay. We're going to get into her case, which
Yeah.
is completely different and worse than his. So could you imagine?
So right now, when I eat, my wife will say to me, "So how does it taste to you?" And I say, "I'm really functioning basically on sight and texture in my mouth." So, like, I made grilled cheese the other day, couldn't smell it at all.
Okay.
So yeah.
Okay. So a lot of people might be watching this thinking, oh my God, I'm having those same symptoms months later. I had COVID myself, and I lost my sense of smell for about 4 or 5 days, I would say, and then it slowly came back. Now, I get regular chiropractic care, but I want to explain what he said that he had heard on the news. There was a chiropractor in Houston, Texas, that restored someone's sense of smell with an upper cervical adjustment. So that's what we're going to do today, and I'm going to explain why an upper cervical adjustment might reduce his symptoms and also alleviate his loss of sense of smell. So I'm going to explain that. We don't have real complete answers as to why, but I will explain it now. So his brainstem lies up here in the neck, and C1 and C2, the first 2 vertebrae in the neck, which is what I adjusted on him. I adjusted some other areas, but those were the 2 main areas. that we were looking to adjust to, alleviate the loss of smell that he's had. So what happens is those two vertebrae surround the brainstem, and by aligning the spine in that area, in the top of the neck and around the brainstem, we're allowing the nervous system to communicate through the brainstem, through the cerebellum, to the cranial nerves, and we're allowing the cranial nerves to communicate with the nervous system properly. And he may have had a neck issue way before COVID even hit. I'm not saying that his sense of smell is lost because of his neck alone. Obviously, COVID triggered it, and we're not sure how that works. It attacks the cranial nerves somehow for some people, and some people it doesn't. But that's what we're doing. We're trying to get the communication wires between the rest of his body, through the brainstem, through the cerebellum, to the cranial nerves, and the rest of the body working properly. And in a sense, that's what we're doing in a simplified sense. So I'm going to show you what we're doing with him specifically as far as upper cervical adjustments. So I'm going to have you lay down on your stomach first.
Okay.
So we used an ARTHROSTIM. We're going to do the same thing on him today. And there's another form of treatment that's been found to be effective for people that are losing their sense of smell. And in your situation, we'll talk about that in a little bit. And that's called cold laser therapy. But since the upper cervical adjustment worked well for him, we're going to just keep it as an upper cervical adjustment, see how he does with the second one, and then go from there. So I'm just going to loosen up some of the muscles here in the top of the shoulders. Now, I'll be honest, when they first came to see me, I wasn't sure if I could help them at all, and I told them that. I was honest with them and said, I just don't know if this is going to help. We're sort of charting a new territory here with this whole loss of smell. It's not a common symptom prior to COVID, and now since COVID, it's very common for people to have that problem. So, different types of treatments are going to come out for this, and we don't always have an explanation as to why it works, other than just anecdotal evidence that it does work. But anecdotal is better than nothing, especially when we're dealing with a new symptom, a new condition that really we haven't seen prior to this. So. And how was that? Was that a little sore on one side more than the other?
Yeah, a little bit more on the right.
Okay.
Yeah, feels much more loose now.
And just relax yourself here. And turn over on your back, please.
Head down there? Or,
Yep, head down there. Slide down just a little bit for me. Good. Cross your arms in front of you. Good. And tuck your chin. Deep breath in. And come on up. And blow all the way out. And slide back.
this way.
Yep. Okay, so when I first got my hands on his neck, on his cervical spine, one of the things I noticed was just a lot of stiffness right away. Then I also noticed he was subluxated at C1, C2, which are the top two bones in the neck. So some common symptoms one might have with a subluxation at the top of the neck at C1 and C2. Dizziness, vertigo, which are really the same thing. Headaches, sinus problems, a lot of sinus congestion, a lot of sinus pressure, issues with the vagus nerve, so acid reflux is another one. When we adjust C1, C2, we are affecting also his vagus nerve, which is another cranial nerve that runs through the neck, okay? So we're going to do a mixture of techniques here on his neck. We're going to do a little diversified here. And just relax yourself here. Good. We got more motion today than we did last time. Okay, let's have you lay on your right side. So there are a few ways to do upper cervical adjustments. A few different techniques, I should say, and I know about 3 or 4 different upper cervical techniques. I'm going to have you slide down that way. What we're using today is slide up just a ½ inch, right there. Good. What we're using today is something called an ARTHROSTIM, but upper cervical work can be done with many different techniques, as I just stated, and they all work, some better than others. So I'm going to do this technique here again on him, see how he responds. There's another technique that I prefer called toggle recoil, where the piece pops up and then drops down. But this is also really effective and precise. Okay. Okay, lay on your back. So that's all it was there. You barely even heard anything. It's a motorized piece of equipment that does probably about, I think, 20 impulses per second. Relax yourself here. Good. Okay, why don't you sit up and see if you can smell your armpit. Just kidding, bad joke. Actually, that's how I first realized I couldn't smell. I mean, no joke. I came back from a run and I didn't smell, you know, like, said, how can this be? And then I went and I got something out of the fridge. Can't remember what it was. Oh boy. And that's when I realized, and that was about 4 days after I had caught COVID. I had really mild symptoms. But we're going to see if we can find something for you to smell. Do you have anything like gum or anything like that? Let me think here what we can find.
Does it make sense to do it on the other side too, or is one
No. We don't want to do it on the other side. I adjusted you on the other side, but we don't want to adjust the same segment on the other side. Let's go ahead and see. Do you smell that? Menthol?
Not at all.
Not at all, okay. All right, so we saw him a little bit over a week ago. What I'm going to recommend that you do is see me twice a week, just for a few weeks here. As soon as it returns, we release you from care, okay?
It did take until the next morning on the left.
For you to notice it took the next morning. Okay.
Notice the one change, so.
Stay off your phone for the next 2 hours, no head down, and we'll see you later in the week, okay?
Yep.
Thanks for tubing in, folks. And if you have any questions or comments, feel free to comment below.